especially the urban American community, we're just so focused on healthcare, engineering, pharmacy, doctor, engineering, pharmacy, doctor. So a lot of our mentors or people that we can look up to are in those fields, and it's really hard to pave a new path and learn something new.
You realize there's a lot of work involved with being a pharmacist. It's not this comfortable job where you're just chilling back on a chair counting medications. There's a hustle that's constantly every single day, and you're dealing with a lot on your plate.
We're talking mindset, we're talking influence, right, and impact, and how can you establish yourself on the team? And again, it definitely helps. And I think what you're talking about there too is you can talk about advocacy, right? You have somebody advocating for you.
Because once you know what you don't know or how much more you can know, you kind of feel like, man, shouldn't be. Then you start actually interacting with people and realize everybody around me is a moron anyway. Welcome back to episode 2 of Steamrolled, where we steamroll through all the conversations. Today I'm joined by 2 pharmacists. I'm also currently a pharmacist, not practicing. Joining me today is Imran, my brother, and Sal Bazzi. Yeah, so we got 3 pharmacists with you guys today, and we're gonna discuss basically what it's like being a pharmacist. Was it the right career choice for us, and is it potentially the right career choice for you? So we'll start kicking it off by having Imran introduce himself and basically what that journey of becoming a pharmacist is like.
Yeah, hey, so I'm Imran Hazam. I've been a pharmacist for close to 6 years. It's crazy how fast time flies by. I actually graduated with my younger brother, Amro. It's been a fun journey the last few years.
Mr. Sale?
Yeah, so similar pathway for me. Just about 5 years ago, I graduated. So right after you guys by 1 year. Took a different path, though, out of state. A little quicker route with a 3-year program. But
which school did you go to?
Lecom in Pennsylvania.
Lecom, okay, nice. So you do what, 2 years there and then a year here? Right?
2 years there, and then that last year rotations back in Michigan. Yep.
Okay. So it's kind of like the Walmart version of pharmacy school?
Pretty much.
So we did go to Wayne State University, right?
Yep.
I still regret not going to Lecom, right? That extra year that you have practicing a pharmacist, you end up making up for that, for, I guess, getting to stay home in a sense.
Yeah, it's definitely a different experience too, going away for school rather than just being home all the time. So a little bit of different work, being independent out there, kind of relying on yourself and the program.
Nice. So actually, to kind of link that back to Dearborn, how many people from Dearborn were actually in Lecom?
Man, out of 130 or 40 people in the class, I'd say there was easily about 40 to 45 probably from the Dearborn.
That's crazy. And that's just Lecom, right? So I know there's the other one in Tennessee.
South.
They also got like 30, 40 students there.
Out of like 70 in that program. That's like mini Dearborn down in Tennessee.
Dearborn's like literally a manufacturer. We're manufacturing pharmacists left and right.
Yeah, you guys are forgetting about the Chicago schools. Right, there's a bunch of people in the Chicago schools area as well. So, I mean, and Ohio, Toledo, right? UT has a lot of people over there too.
So what we're saying is there's a shortage of pharmacists in Dearborn.
Pretty much.
I mean, having chosen pharmacy school, right? So what led you to that decision? What made you go to pharmacy? Is there something that you want to achieve? And basically, would you go back and make that same decision?
It's funny listening to you guys talking earlier about how you went to Lecom because it's a 3-year school, and then you should have cut an extra year of school. Like, I had a different experience than you two, right? Like, I did undergrad for about 7 years before I got into pharmacy school versus you guys were trying to rush through that thing, right? So, I mean, for me, it's definitely opened a lot of different opportunities. You hear a lot of people talking about what pharmacy is. But what people don't realize until after you graduate or unless you're in the pharmacy field is how many different opportunities there are outside of just what people think you do, which is just counting pills, right? I mean, there's so many subdivisions of pharmacy that it's actually like even right now as a pharmacist, like I get surprised based off of the number of opportunities out there. So, my career journey so far, I've definitely appreciated it, and I have a deeper appreciation for what pharmacy has offered, looking at what other opportunities people have kind of pursued.
Sal?
Similar route for me. I feel like the biggest thing for me was, and what's different from what you see with a lot of what's going on now is I actually had experience in the pharmacy before going into pharmacy school. So in undergrad, I knew I kind of wanted to get into that pharmacy role. You just see the lifestyle they lived. It's a professional degree. You're working in the healthcare field. But they also, it seemed back in the day like it was a lavish lifestyle, right? You see big houses, nice cars, comfortable lifestyles. You kind of come to realize maybe that's not the case for everybody. Some of these people that started off early in the game it was a different lifestyle back then, when pharmacy was still growing and when it was still a huge need for pharmacists back in the day. But things have kind of changed that path now. So to me, I went through kind of the opposite of what he did. It was a fast paced program. So I didn't get my bachelor's. So it was about 2.5 years of undergrad, had a nice little semester break, and then right into a 3-year program. So I graduated pretty young at 23 years old. And sometimes I think back, I'm like, man, can't believe they trust somebody at that age to deal with your health needs. But it's crazy what you're able to do if you put your mind to it. But the pathway for me was great. I've also had a quick shot into the field. So jumping in, like I said, at 23 was a unique experience for me. Definitely, you learn to trust yourself a little more.
Right. Right.
On that point that Sel was talking about, right? Like back in the day, people had a different lifestyle. I mean, I think that kind of speaks volumes to the way the pharmacy field kind of ebbs and flows through the times, right? There's a time in which there's a shortage, then there's a surplus of pharmacists, then a shortage again, and the wages kind of follow that trend. So the more pharmacists there are, the more of a surplus, the less that there is of a compensation, right? The compensation kind of follows that flow. But another factor to consider these days is also just inflation and the way the economy is, right? Like the power of the dollar no longer has that same power that it used to. So it's interesting. Like, yeah, I think sometimes, like, what's it like being a pharmacist 10, 15, 20 years ago versus what it's like now. The flip side of that is there were a lot less opportunities for pharmacists back in the day than there are now. Like the field itself has grown tremendously. So it's an interesting dynamic, just looking at it that way.
So my personal experience is completely different than both yours, right? So you haven't paved the way to pharmacy, kind of streamlined that for me, and I was able to do 2 years of undergrad, then 4 years of pharmacy school. So I still, I graduated pretty early as well. And like you said, you kind of like, what the heck, they're gonna trust somebody so young, right, who hasn't got shit figured out in his own life, to go out there and be a healthcare professional. But you learn so much, right? I remember, I think like second year of pharmacy school, that's when I realized, like, now if find me somebody who's an engineer, right, or a computer science major, like, I appreciate what they do, because as soon as you start learning about actual medications, you're like, damn, I knew nothing, right? You thought, you swallow this pill and the way it works and the dynamics, and it's like, no, there's a lot more to it. There's so much more complexity behind it, and you learn so much than what you actually use on the field. But I feel like I got to a point, I worked for a year, and other opportunities opened up, and that led to other opportunities, and I just kind of diverted away. And what I learned is, honestly, it's very hard to be passionate about pharmacy. I think unless you know specifically what you want to do with it, right? But it's just in general, I'd say majority of people aren't really passionate about it, right? It's more of just a job, and it's unfortunate, and that was kind of my experience. But I ended up liking it, and I wouldn't say I'd say I tolerated it. It got to a point where I was like, this is a gig, and it was good, but something else opened up, and you go through a whole different experience, and that's something I wish I would have been told, at a younger age. Is kind of, hey, there's so much more for you to do out there. And I think the biggest thing, which I've talked to a few people going to pharmacy school, is they think it's the cheap, dirty way to become a doctor, right? It's more of like, hey, it's faster. You're still a kind of a technically a doctor, right? You do get your doctorate degree, but I don't want to go to med school, right? And how many people did we know in pharmacy school that, in mid-pharmacy school, including myself, actually almost pivoted to go to med school? Because you're like, hey, we're learning the same material, right? We're just not specified in certain areas, but you kind of get there and you're like, why didn't I become a doctor, right? If I really wanted to be in the healthcare field. And I know, the talk about what pharmacists do and the relationship with the community, you really are like that patient contact, right? Majority of the questions come through you. Doctors are usually a lot busier, right? People coming for over-the-counter medications. You're the one that they talk to and deal with, and you kind of guide them through that process. So you are a very accessible healthcare professional, right? But my question came to myself is, yes, I see the value in this, but is it really what I'm passionate about?
I think the biggest thing with that is knowing the expectations of what you're getting into. Like I said earlier, a lot of the newer generation, you see they're in pharmacy school, and on their rotations in pharmacy school is their first actual experience in a pharmacy. So they might look at their older brother, older cousin. They see this guy's making, you know, $10,000, $12,000 a month, whatever the case is going to be. And they're like, man, this sounds like a good amount of money to be making at 23 years old,
Right.
with no idea of what's actually going into the field. I know my experience was an undergrad before I got into pharmacy school, and I learned quickly it's not an easy role. You see what goes into it, whether you're an independent or you're working for one of the big chains, whatever the case is going to be. You realize there's a lot of work involved with being a pharmacist. It's not this comfortable job where you're just chilling back on a chair counting medications. There's a hustle that's constantly every single day, and you're dealing with a lot on your plate. So I think knowing what you're going into, and you mentioned like how a lot of people want to pivot into medicine. I can tell you have a lot of friends who are in medical school or doctors that kind of wish they pivoted into something like pharmacy.
Really?
So I feel like it's never the grass is greener on the other side. It's like you really want to know what you're getting into is the tough
100%.
piece.
100%.
All the guys that go into medical school, once they get into the field, yes, I have the white coat, I have the title, I'm doctor now, my whole family,
Exactly.
I'm a real doctor, right? But then it gets down into, oh shoot, like I just got my first lawsuit now, a medical malpractice.
Right.
Then you start catching these cases and you start to see the stress you're going into.
The reality of it,
yes,
basically.
the real side of it. And you realize that you're never really off the job as a doctor. Depending on your field, of course, it fluctuates. And sometimes you go really big, you become a surgeon. Then you really realize the type of risks you're putting yourself into. You might finish a surgery and you don't know what's next. Like, hey, did I take care of this patient? Did I mess up somewhere? I'm catching these lawsuits. There's that constant stress. And sometimes they might think back and like, hey, maybe a pharmacy is less stressful for me. I could have finished a little earlier with less student loans. And I feel like no matter which side you pivot to, it's always like, man, the grass looks greener on the other side, but is it really?
That's very fair. That is. And then, I guess a lot of people that, like you said, you kind of mentioned it, but the reason we do go the medical field in general, right? Just I'm talking about in general, right? There are, people who go in for more passion reasons, but I think people do seek out the prestige and the pay, right? They want the status and they want the pay, right? When it comes to pay, I think, but a lot of people don't know where those opportunities are, but there are better and other opportunities if you're seeking the financial gain of becoming a pharmacist. And when it comes to the prestige, right, it's nice, but once you hit the reality of you're a pharmacist, you're going in, you're doing the job. I think one of the most pivotal moments for me as a pharmacist was I was practicing and patient came in, got their meds, and I was able to save them a lot of money on that medication, right? And at that moment, I realized, she thanked me. She was being so appreciative, and I was like, wow, you really get the most out of you get what you put into it, right? If you're just there, like you said, just counting pills and doing your job, it's kind of like, you know what I mean? What is this? But then if you actually apply yourself and try to help people and actually give care, you can do either or. And if you do put that effort in, I feel like you get more gratification for it, and you yourself appreciate your job more than just a job.
So I mean, you guys talked about two things right now, right? So you brought up the concept of expectations, right? And the easiest way to be disappointed is to set an expectation, because you most likely are going to be experiencing things that you did not foresee, right? In your mind, it's probably something completely different, right? And then you mentioned prestige, right? Like there's this idea like I'm a doctor. And so again, there's this expectation set with what that looks like. And then when you actually see what you have to do on a day-to-day basis, being a pharmacist by far is a very challenging job to do, right? Like it is not something easy. You have to juggle between multiple different things that you have to deal with on a day-to-day basis. And then a second thing I would say to that is it depends on, when you're talking about passion, right? I agree. I think it really depends on what is it that you're looking for out of it. Me personally, I actually love being a pharmacist. I love what I don't think there's been a single time as a pharmacist where I was like, man, I made the wrong choice, even during the most difficult times. And a part of that has to do with like what meanings you give things, right? And the perfect example I'll give is there's a lot of people that you would hear sometimes say like, I just can't catch up. Like I'm working so hard and I'm dealing with the team, and at the same time I get people just constantly coming in or calling, right? So the meaning of that is, hey, they're interrupting kind of my workflow, right? Like, hey, I'm being interrupted so many times, versus the meaning I gave it, and I've always and it's worked out for me. And obviously everybody gives it a different meaning, but for me, I look at it and I say that's another opportunity for me to help somebody out in any given way. Does that always happen? No. Or there's sometimes instances in which you're like, all right, like that could have been an easy question that somebody else could have handled. Absolutely, right? But again, that meaning, like now I don't look at it as being interrupted. Rather, I'm looking at it and I'm saying, you know what? Like this is an opportunity for me. And it's a play on words sometimes, but I do feel like that's what we struggle with sometimes, like in the pharmacy field, is taking a look at what we expected out of the role, one, how we see ourselves in that role, two, and then three, it's like what is the actual role, and then what meaning do we give to our day-to-day experiences?
Right. So I mean, I guess I don't want to come off as anti-pharmacy, right? I just want people to understand. Don't just jump into it, like you said, because your uncle did it, or people say this is the good job to get into, right? Make sure you understand what you're getting yourself into. And I think the hardest part that I wish we could just change, and especially the younger generation coming in to the workforce in general, right? Going to school, going to college, you feel like you have to go to school. That's just a given. That's how I felt. Just you have to go to school, so pick something, and boom, pharmacist was the top of the list, easier to do. I don't want to go to med school. And I think a lot of people fall into that trap. So I guess what advice can we give to these younger, the younger generation, people that are trying to pursue maybe pharmacy or anything else? How can they actually find something that they may be passionate about, or at least how can we teach them all the other opportunities that are actually available to them? Because there's a lot of times you don't know unless you have an example, right? If somebody tells you, hey, you do X, Y, Z to kind of get this done. And again, you going through pharmacy school and kind of lining it up for me, right? It made it so much easier for me. Whereas you took 7 years to do it because you were paving the path, right? You didn't know the structure. You didn't know, well, I got to do X, Y, Z, right? So having a mentor in general for any field is very important. But a lot of times, because especially the urban American community, we're just so focused on healthcare, engineering, pharmacy, doctor, engineering, pharmacy, doctor. So a lot of our mentors or people that we can look up to are in those fields. And it's really hard to pave a new path and learn something new. And I guess what do you take that in terms of how do they balance? Do they really want to be a pharmacist? Do you really want to be a doctor? Versus, hey, maybe you should pursue something else that you might be a little bit more passionate about.
So I like that you brought the idea of me paving the way, right? Although it wasn't, I paved the way in terms of the college experience and knowing how to go about pursuing a secondary degree, right? Like a graduate degree. But, we entered pharmacy school at the same time, right?
Right.
But, there's this concept out there that mentorship is definitely key, right? You need to look at somebody who's done it who's done it before you, right? That I agree with. And then there's a second aspect. Like if you want to be successful in any area, mimic a successful person too. Not necessarily just mentorship, right? So this could be through a Q&A. This could be through popping in anywhere and just asking a question. Hey, tell me about your career path, right? Like if somebody right now were to come in, if we had somebody here who's asking about pharmacy, whether to become a pharmacist or in pharmacy school, all three of us have different experiences, right? So my experience would be, I would probably talk about just being goal-oriented and perseverance in figuring things out as you go through. Versus for you, you might probably recommend like, hey, don't do it just because it's the easiest pathway, right? Or because that's what's been laid out in front of you.
Right.
And then Sal, you might have a different experience just to say like, hey, honestly, I just wanted to get this thing done like really quick, as quickly as possible, right? Graduating at 23. So my advice to somebody is it's easier said than done, but seek somebody who's done it. Seek multiple people that have done it, because I think if somebody came and talked to you, right, and said, hey, how do you like being a pharmacist? I think they're going to get a different answer from you than they do from me or from Sal, right? So that the person that you speak to initially can set a tone for what you're pursuing, right?
So funny you say that. The very first person I spoke to while getting into before actually entering pharmacy school, was a pharmacist, and he's like to me, have you worked in a pharmacy? I said, no. He said, work in a pharmacy first, as a tech, before you decide to go to pharmacy school. But at that point, I was already invested in. But that was great advice that I never took. And I think that's something somebody can do is while you're pursuing your undergraduate degree, even once a week, if you really don't, need to work for the actual money, get the experience, see if it's really for you, see what it's like, And then also, there's obviously other opportunities in the pharmacy world other than just, you can also work it as a tech in the inpatient, world or whatever it is that you decide to do. But gain some experience just so you can kind of at least understand before it's too late. Because again, I know that I think very good advice is regardless of what job or career choice you've chosen, you really can, whatever you get out of it is what you put into it, right? And I think that's what you're saying in terms of you guys have a different perspective. And the truth is, I think it's more about mindset than it is anything else. But having, I guess, the experience of kind of seeing what's to come prevents any regret. And I did see that in pharmacy school. We did have a few people near the end. And a lot of it is exam stress and, you know what I mean, and all the stuff that we go through. But you do see some people that are like, hey, I don't know if this was the right decision for me, right? And I just want to give somebody, give people advice in terms of what decisions can you make early on to prevent you regretting, but also understand that there is great opportunities in the pharmacy world if it is truly what you want to pursue.
I think the biggest thing is you have to stay curious about it, right? If you're going into pharmacy school, like you mentioned in your case, and you have no idea what pharmacy is minus what you've heard, you really don't have the expectation of what your career is going to be. Versus how many times I can say I've brought on technicians who their goal is ultimately, I want to be a pharmacist.
Mm-hmm.
Then they realize, you know what, maybe this isn't for me. Sometimes they'll pivot somewhere else into the healthcare field. Sometimes they'll just pivot completely away from healthcare.
Right.
Next thing you know, they're a teacher, they're a personal trainer. They just don't think school is their route. They might go into like real estate or something. And we see a lot of that nowadays. So I think the biggest thing is being curious, and it's having that experience. And no matter what field you're going into, right? If you want to be a dentist, go become a dental assistant working in the office. Even if you're just at the front desk, a little bit of exposure to what the actual field has in. And then you mentioned also talking to a person. And like you guys said, that first person might set the tone for you, right? Now, they might set the correct or incorrect tone. You might talk to a pharmacist on a bad day and tell you, hey, I think I have the shittiest job in the world. But you might catch that person who truly likes their job, and they'll tell you the true ins and outs of the field. And somebody who's going to give you a real honest, their judgment call on what the pros and cons of the career are.
Right.
And like you said, there's different routes too. So I know typically the most well sought out positions in pharmacy, or the most exposure we get to them are in like the retail setting, your typical community pharmacist. But then there's people going to the clinical role. There's people going to the business side of things. You can get completely away from the actual healthcare setting of it.
Jump on that to keep it real. Please disagree with me if you do. But if you're trying to go into pharmacy, into the clinical route, just be a doctor. That's the experience I had doing, the hospital rotations. And I'm sitting here, I'm like, we're essentially, yes, you're just there is a clinical role for pharmacists, but in terms of what you're doing, and what a doctor does, it's just they have more, more responsibility. They're actually more actively involved in the patient care. So if you're really interested in patient care, especially in a hospital setting, put the work in, invest the time early on, and just be a doctor. Do you agree with that? Is that something you disagree with?
I'll tell you, I've seen both sides of that on rotations, right? You'll work in the setting where the doctor is desperate for the pharmacist, really struggles to make that decision without that clinical pharmacist, to where they play that big role on the team. Then there's that other doctor. I mean, you could fall into either side. You could call them arrogant or really strict on what they want, where like, listen, I'm just going to make the call. I have the final say. I'm the doctor. So I've seen it on both sides. Ultimately, I think it depends on the personality you have and the team you're working with.
It's interesting you say that, because you just sparked some memories. It's been a few years, right? But I actually do remember at different hospitals, I seen entirely different culture. Certain hospitals where the pharmacists were really pivotal in the healthcare process, right? And they have a role, and it's a team. And then the team of doctors comes out, and they seek their help. And other hospitals, it was like, what are we doing here? You really felt useless. With all due respect to whatever hospital system it was, but I guess the culture in the hospital and the institution you're in also plays a role in that.
Yeah, like I can tell you some of my experiences, like the doctors don't do rounds without a pharmacist on the team doing rounds with them. And there's that other side where you'll see doctors will do rounds with a pharmacist, but the pharmacist gives no input. So again, I think it goes back to the personalities you're working with. It's very different than medicine, of course, right? Some people might not want to do that full stretch of schooling and programming.
True.
And there's also different levels of responsibilities. I think there's a lot on the clinical pharmacist responsibility, because ultimately you're seeked as the professional before we're injecting this in an IV. And we know when something gets into the person's body, especially if it's directly into their blood, you made a big decision there. So obviously, there's hospitals have programs and procedures and protocols when it comes to medications, but I think it's a very different role.
So just so we could clarify that real quick. So in the hospital setting, there's two types of pharmacists, right? You have a clinical pharmacist who's more involved in the actual patient care on the team, right? The process of deciding what dosages to give to medications and whatnot. And then you have your inpatient pharmacists, which work usually in the basement or the pharmacy, the inpatient pharmacy, compounding medications, and basically getting the medications up to the patients. So when you're mentioning rounds, that would be more of a clinical pharmacist role, whereas, making sure you're dosing the right IV packages, that would be the inpatient pharmacy role.
Yeah, similar to that. I mean, the inpatient pharmacists, of course, play a little bit of that clinical role. You have to make the decision, like, is this okay for this person to take?
Right, for the dosing.
Yeah.
Right, yeah.
But I don't think they're working directly on site like the pharmacist that's doing the rounds would be, where they're ultimately working on making that decision actively.
Okay.
Yeah, so the clinical the clinical pharmacists really are more in tune with like guidelines and specialized, right? So like there's like a cardiovascular a pharmacist that specializes in the cardiovascular unit or the neurosurgical unit, right? So those pharmacists are in tune with the guidelines of specific situations versus an inpatient pharmacist gets an order for medications and they're making sure that it's safe based off of the parameters or the lab values that they receive for a patient. So it's more of a specialization versus a general pharmacist role.
I feel like I'm coming off a little bit negative on pharmacy, right? The reason I said earlier, be a doctor, is more of, it's just from what I saw in my experience, right? I saw certain pharmacists that were trying to go beyond what the parameters of their job as a clinical pharmacist were, because you could tell that, they really wanted to be more involved in that process of, caring for the patient. And it's like, you see, and it's like, you should have pursued medical school because clearly you're passionate about it, right? And that's basically why I brought that up, is in terms of what do you actually want to do? If you really are intrigued with medications, right, and adverse effects, and is this the right combination of meds for somebody, and being a part of that team, it's actually very critical, right? We've seen that. I think a lot of medical errors were, greatly reduced by having a pharmacist, on the team, on the care team, as opposed to just on the end of dispensing medication. But it's more of, on a personal level, is this something you really want to do, and to what extent, right? Because I remember going into an interview for pharmacy school, and it's like, pharmacy is so versatile. You can go into community pharmacy, you can go into clinical pharmacy, but I didn't know what the heck clinical pharmacy was, right? I'm just spewing that for the interview, but I wish I knew, before what I knew now. And I feel like, again, I still say majority of people that are trying to get into pharmacy school now are doing it for either financial reasons or for, the reasons of prestige. And I feel like if they can make a better and a more informed decision, it could lead to even, hey, if this is what the expectation of what a pharmacist is, you'll end up being a better pharmacist because your expectations and mindset are already set from the get-go, right? You're already going through pharmacy school, gearing yourself to what to expect and what your career is actually going to look like, and that'll lead to less regret and less kind of surprises on the back end.
So, on that note, right, there's definitely a place for clinical pharmacists, and I think this is just to address the point of like, hey, if you're going to do clinical pharmacy, why not just go to med school, right? And I think there's a few factors that can go into that. If you're there for the prestige and the money, I would agree with you, right? Like just go to medical school and just go through all of the training and the residencies and the fellowships and just specialize and call it a day, right? But then there's a flip side of that, which is there are people who are passionate about patient care, are passionate about medications, are really good with the math, and they can talk pharmacokinetics and pharmacodynamics and talk all that kind of stuff. And maybe they're not interested in surgery or interested in just following a guideline, right? So I do think there is definitely a clinical place or a place for clinical pharmacists,
I'm sorry, to that point, that's actually something you kind of just reminded me of, in terms of if you want to be in the healthcare field, but you're kind of, I don't know, what's the word, kind of ickish about medicine itself, right? About seeing somebody's skin rash or actively seeing the diseases or the injuries of the patient. I think a clinical pharmacist is probably perfect for you, right? Because you're actively involved in the healthcare, the healthcare of the patient without actually having to to be directly involved with the things that you know might, I guess, disgust you in
Yeah.
that sense.
So and then yeah, absolutely, right. So there's that aspect of it, right? And then the other aspect of it, I think you guys were mentioning earlier how there's different healthcare systems and have different dynamics
That's true.
with with pharmacists. Look, I will look at that. So I always like to look at the lens. I always like to do introspection before I look at somebody else, right? So like I won't sit here and say, oh, that's the hospital's fault. I won't sit here and say that's the doctor's fault. As a pharmacist, I'm going to say, what can a pharmacist do? And I will almost, I don't want to put a guarantee, but this is a common theme where in those settings where the pharmacist is heavily utilized, I'll guarantee you that the pharmacist plays a critical role in that.
100%.
And that's they make themselves resourceful, right? And it goes back to that mindset, right? They find a way to make themselves resourceful, and they also do a great job of building relationships with the doctors to show them how important they are, right? Oftentimes, and this is actually I think something that we could talk about probably next, but the idea of what's the biggest opportunity for pharmacists when they graduate pharmacy school, and it is the people piece, right? It's how to establish yourself in front of a team to say, hey, I am actually a clinician as well. So how to have that confidence and how to deal with people. But a lot of people that graduate pharmacy school, and we see this, it doesn't matter what field they go into, but a lot of people end up being very hesitant with the people piece. They don't know how to have that conversation and how to agree or disagree or push back when
Right.
they know that they're right. We do have this kind of role where it's kind of like we're in the background of the team, right? And oftentimes, if you look at the pharmacists in the healthcare settings that incorporate the pharmacist as part of the clinical team, you'll probably see the pharmacist front and center on that rounding, right? Versus those other settings, the pharmacist is probably sitting in the back of that, behind the nurses and behind everybody else. And it's like, okay, I'm just going to sign off on this, on this recommendation.
So I guess the institute plays a really big role, and that's something that I did see. Right, I know there's, like you said, certain places where it's kind of like you're in the background, and then there was one hospital that I was at, and the pharmacists were actually carrying a big burden for the doctors, right? Hey, dose this Vanco for me. Hey, dose this warfarin for me, right? So they could focus on other aspects of the healthcare, for that patient. And there was a really great doctor at one hospital I worked in. This guy was, man, superstar, right? When you go into the patient to do like consultation or whatever it is you're doing, you're not allowed to walk into the patient's room without a stool, right? So you need a stool, meaning he said everybody gets to eye level with the patient. It was funny in the sense when you see 7 people sitting on a stool in front of the patients, and the patients are like, what the hell's going on here, right? But you have the doctor, the residents, the med students, the pharmacy students, the pharmacist, and you're just sitting there on an eye level. And this guy was like I said, a rock star of a physician, right? And then it's crazy because they would do like week on with this doctor and then a week off with the other doctor, and you'd see like night and day, right?
So to that point, I just want to touch on this really quick. You think about what that doctor did, right? And what you're talking about was setting a culture in a sense, right?
Right.
So we're looking at it and we're saying, hey, how does that impact the patient, right? Obviously, you're eye level with them. You're gonna connect better with the patient, and you're able to make stronger recommendations, and you're able to establish trust. The flip side of that is, what did the doctor do for everybody else on the team? You make it a level playing field, saying, hey, we're all equal, we're all on the same team.
And to that point, which is the point I was trying to get to earlier, is about this doctor. Well, a little off topic, but we were sitting there once. This guy's white American doctor, and we're sitting down, and this lady starts speaking Spanish, and then this guy starts going off in full fluent Spanish. I was like, this guy was like plucked out of a book or something. I was like honestly shocked, right? This guy is just, like I said, superstar of a doctor. I was like, if I were to ever go to med school, that to me is what a physician should be like, And what he did is, I remember, again, we're sitting there having like meetings, right? And like you said, with other doctors, depending on the team or other institutions, you're kind of in the background, just whatever. And he would literally single out pharmacy students. Hey, we're talking about this medication. Why don't we do this and that with it? And then we got to show off, right? Because the med students see like, hey, damn, these guys know their shit when it comes to medicine, right? You kind of get that chance. But realistically, what he's doing is he's getting you involved, right? He's saying, hey, you're important too. Come on in. And that's the culture around, what a clinical pharmacist does. I still think there's a lot of work that needs to be done, right? Because you go to another institution, it's in a completely different story. And there's a lot of work to be done in terms of pharmacy. And I think there are pharmacy organizations, pharmacy programs they're trying to push and advocate for them. That's how change happens. It doesn't happen overnight. It takes time, right? But that was just an example of how, similar to what you said, the the culture that's set around it definitely plays an impact on what to expect in that field. Anything to add to that? No. I think we'd be clinical pharmacy too.
Yeah, no, I mean, look, we weren't really just talking about clinical pharmacy there, right? We were talking concepts, right? Like we're talking mindset, we're talking influence, right? And impact, and how can you establish yourself on the team? And again, it definitely helps. And I think what you're talking about there too is you can talk about advocacy, right?
Right.
You have somebody advocating for you, right? And I, I know I personally saw it during clinical rotations where the pharmacists were really good advocates, right? But nobody's going to advocate for you the way you advocate. And so my thing to you about the pharmacists that are out there that are not integrated into the team as they should be, a high sense of ownership falls on us.
So take it upon yourself to make something change.
Absolutely, right? I mean, you have to advocate for yourself. You have to advocate for your field. And at the same time, though, ultimately, we're all patient advocates. And so if I sit there and I'm kind of in the background and I'm not, I don't position myself to have a strong voice on the team, really what I'm doing is I'm not advocating for the patient at that point. So then this goes back to that question earlier about like, what are you passionate about? And I will tell you, like, I do think that a majority of our clinical pharmacists really are passionate about patient care and they want to incorporate themselves on the patient care team, right? So if you really look at it from that lens, I think people will find whatever they need to find within themselves to be able to have a stronger voice and advocate not only for themselves, but also for the patient as well.
Very well said. I feel like, I don't know if this resonates with people who haven't seen the pharmacy world, right? You know what I mean? Like in terms of actually what it's like in there and the struggle. There's power dynamics as well, right? So just in general, right? You're getting into a hospital or health or clinical setting. You have the pharmacists, you have the nurses, you have the physicians, right? You have the radiologist. It's just, and everybody has a role to play, but then there's also politics and culture, and I think my experience taught me that, the first initial setting that I had for a clinical setting for pharmacists, as a pharmacist, was my first rotation was at a hospital that was superb. My expectations were set like here, I was like, okay, this is what a pharmacist, I actually started intriguing me, like, hey, this is something I might be interested in. Then my second experience was, I want nothing to do with this, and I looked my preceptor straight in the eye. I said, this is what you did. This is the work you did. I'm like, this is what you asked me. You asked XYZ, so I did XYZ. I'm not gonna do XYZ and ABC, right? Because I'm really not passionate about this. I think I'm going, the retail pharmacy route. She was really pissed, you know what I mean? But I just kept a level with her.
I think a little more than pissed.
Yeah, it ended up rubbing off on other people, but it's fine. Again, I can't really personally, I can't, like, if I'm passionate about something, I can give it 150%. If I'm not, it's like pulling teeth, right? And honestly, I felt that way through pharmacy school, right? I feel like my potential in pharmacy school was so great, so much. Like, again, I did really well, alhamdulillah, but it was so much more that I could have done because I knew I wasn't really applying myself to that extent because I wasn't truly passionate about it. Whereas now I've kind of diverted away from pharmacy, right? You go from pharmacy to the business world, to the food world, to the Instagram, internet world, to the podcast world, right? And you see, like, it's more of when you're passionate about something, you'll do that extra. I'll do 40 hours editing a podcast, and it goes like that. And I don't even know, it doesn't feel like work. I'm enjoying the process. I like to see the product, how it turns out at the end, on the inside. It's like, wow, you created something. And I feel like there was no way that I could have ever knew that was even an option for me, right? Growing up the way we did.
So just to add clarity to how passionate Amr was throughout pharmacy school. So he was the type of student that would show up, like, start studying 6 hours before the exam, pull an all-nighter, and then still did well, right? I mean, like definitely very sharp when it came down to pharmacy school. Maybe outside of pharmacy school. First off, can we also talk about how amazing this studio is? I mean, look, that's that's kind of like your style, right? Like you're all in, and when you are passionate, again, you see this, and this happened. Like obviously, you did a lot of work behind closed doors and a lot of research, right? And people don't see that aspect. But really putting this thing together was like a couple of days, right? Like you were able to put this thing together like that, right? You saw the vision and whatnot. But that's Admiral right there in a nutshell. Is I'll show up before an exam. I won't care too much, but I'll still kill it. Versus I was the opposite way during pharmacy school, right? Like I put in the time. I knew what I needed to get to. I had an action plan and whatnot. But it does speak.
I used to envy his discipline. I really did, man. I'm like, what are you doing? I'm on the Xbox, I'm playing, and he's studying. I swear to you, I was playing Halo 5 the night before an exam, 11 a.m. or 11 p.m., and I haven't touched a single, slide. And again, but what that does to your body, I don't recommend that. Oh my God, the stress. Oh man, like after that exam comes out, no sleep, pull on all-nighters, and it's definitely not healthy. But it was to my point of, that's because I wasn't, to me, it was a burden, right? It was something that I really did not want to do, rather than enjoy the process. Because you can be passionate about that learning process. You can be passionate about, learning the next topic, and then applying yourself, and then really seeing, is this for you, right? So I guess a good, litmus test is, if you have to pull teeth to get something done, maybe it's not for you. Maybe it's time for you to pivot.
Let me ask you this. When you transitioned from pharmacy into the business world, do you feel like you learned anything from the pharmacy side of things that supported you with your business and food adventures?
See, that's a good question. I think the answer is definitely yes, but you don't immediately see it, right? It's just kind of, as the process goes on, you realize, okay, you know what? Learning how to be a pharmacist, I guess having 5 techs that you have to lead, coming right out of pharmacy school at a young age, leading is something you're probably not really accustomed to, right? So and it took time, but getting comfortable, delegating tasks without feeling like you're being, bossy, and doing it in a respectful way and keeping a good team built, I feel like that definitely helped me, in the business world. But it's more of, I feel like the difficulties of going through pharmacy school itself definitely built character. It's not easy, right? I know, I said I was playing Halo on that. It was definitely not easy, right? Like, also expect that. Going to pharmacy school, studying, exams, the expectations out of you, the professionalism, it really does set you, you know what I mean? It makes you, I guess, have to change, right, in terms of actually building character.
But I mean, I'll even go back to that too. Like you pulling all-nighters, right, and studying last minute. It worked though.
It did. Again, don't recommend it.
Don't recommend it.
Very unhealthy, but it did, because honestly, I was able to streamline the process. It's weird, but like I would go through slides so quick, and I would it's almost like.
Are you as productive though if you were to start a week out in advance?
No.
I fell in the same trap as you, right?
It's just
maybe not just like the last 6 hours. I was probably like 24 hours before the exam, maybe sometimes that day before as well. But
and
working under pressure,
the light is on.
yeah, like
100%.
you're back against the wall, you're in a corner. I'm gonna grind it out. Like 100%. I have no option at this point.
100%.
Versus, you learn the lecture 2 weeks out. Are you really gonna be able to focus and like, all right, maybe if I review this 15 times, like. I was in a similar boat as you. If I got through it 1 time or got through it 15 times, if I understood it, I understood it.
I think
and it's as simple as that.
That's the best way to put it, is in terms of feeling like, hey, you got it. You have no other choice. This is it. You know what I mean? You're putting everything on the line here. You got to get this done. It makes me, I guess it lets the material stick, and it makes me be efficient in my studying. But it's interesting you say that, because that's the reality of the business world too, right?
Yeah.
The competition lights a fire under your ass. And if there's no competition, you stagnate.
It's grind time when it's grind time.
And when you feel the pressure, you put in more work.
So you guys are kind of reminding me of it's really capacity and mindset, right? Are there people that cracked under the pressure?
Oh, definitely.
You guys can handle the pressure a little bit better, so that's definitely why it works for you guys, right? Me personally, like there have been instances in which I do that, and I can do that, and I know I have the ability to do that. But my quality of life definitely, and you mentioned it. Look, there's a pre-exam Admiral and a post-exam Admiral. The post-exam Admiral tossing chairs around because he thinks he messed up the exam, and he ends up getting an A on it at the end.
No,
of it, right?
I was actually, I don't know what they said, but I was pretty confident coming out of exams. I knew whether I tanked or didn't. You know what I mean? It's I knew enough or I didn't know enough. But that's another thing that helped me is I was a good exam taker. You know, like it was kind of like a game. Like you know this set of information. Here's how they presented the question. Cross out this, cross out that. There's a process, and then I think that's also another tip I'd give people. Depending on whatever, it doesn't really matter where you're going to school. Is treat exams like a game, and that's what I did. Really, it was.
I don't know how sound advice that is. Listen,
Don't play around too much.
You're also pretty good at games, so,
Everybody's
good at games.
I say treat it like a game, meaning it's a puzzle, right? There's a person that wrote that question. They're trying to trip you up. So typically, right? I'm giving my dirty secrets. So typically, there's a right answer. There's a trip up question, right? A trip up answer. Then there's the answer that's kind of like, what the hell did this even come from? And then there's that answer, which again could be solid true. And so I just kind of play that process of, okay, do I know this answer 100%? Yes. Or do I not know this question 100%, but I know something that relates to it, and then I just try to go process of elimination to get there. So there is definitely a process to taking exams, and I think you've seen it. Some people that would go in our class that would go into the exam, man, this guy would run around circles around me in terms of information knowledge, and they'd come out, really pissed because they overthought the question or they just didn't have a process of actually taking the exam.
So just on that note, right? So you're talking about you flex that muscle so long that it's strong. You're able to study selectively, and you're able to know right off the bat by reading 150 PowerPoint slide, you know what to focus on because you've done it so much that you know what's the background information and you know what's the information that could most likely be, that would most likely be on an exam. Versus other people don't, right? Like they have to study everything, right? And there are people that you mentioned, right, that knew the information like the back of their hand, inside and out, and taught everybody, and ended up walking out with like an exam score that they weren't happy with.
Right.
The flip side of that is also exam taking skills. So I think you recall, even though I used to study a little bit ahead, I was always one of the first ones or one of the first two outside of outside of the exam, right? Sometimes 15, 20 minutes on an exam.
Right.
And the reason for that, my strength was I was able to just read a question once, and the first question that pops up to me based off of my information is what I'm going with.
First answer.
First answer. And I trusted my gut with that, right?
Right.
Versus other people would sit there and
They
double
go back
check and go, and it's just like, no, like, hey, that's so the ability you have with studying, I feel like other people have that ability with exam taking.
I would actually just recommend that once I moved on from a question, I took my time with the
Never go
question,
back.
but once I moved on, it's done. It's a wrap.
I think the difference you mentioned with like people who might be able to run circles around you, I think there's a difference between having the knowledge and being able to apply the knowledge, right?
Right.
Like even think about like sports too, right? How many coaches has Mike Tyson had, right?
Right.
They have all this knowledge, they can coach him, give him the tips. Now, how many of those coaches can step in the ring with Mike Tyson?
That's true.
Right?
That's very true.
So I think being able to apply the knowledge and make use of it in an ideal setting is very different than just being able to read something out of a book and memorize it.
There's so many things that go with that too, right? Like you could talk about confidence, right? Like there is a sense of confidence with that. Like I will almost guarantee you that the people that hesitate, despite having the knowledge, question themselves, taking an exam, whatever the case may be, you also put them like in front of people. They're also questioning themselves and probably don't have, because they're sitting there overthinking what they're doing and what they're saying as well. So you guys, your confidence level is definitely very high, even when you guys communicate with other people, right? And that confidence also comes into effect with playing video games or pulling an all-nighter, right? Like you have the ability to do that and you're confident in that ability versus other people might need like a lot longer, time frame. Or more information, or they just need time. Like I also think that the people that have the information but fail on the exams or don't do so well on exams, if you extended the time, they'll figure everything out on that exam. They just don't have that time, and it's the pressure of the time that's also impacting them as well.
And sometimes that lack of confidence, you give them more time, they're going to question themselves even longer.
100%. I will say that I never actually walked into an exam confident. It was like Russian roulette. How's it going to go today?
There's that idea of what's that? There's a term you used one time. Dang, I'm blanking now. Imposter syndrome.
Really realized what imposter syndrome was. I always heard of it, except like when I actually started practicing as a pharmacist, I was like, bro, I shouldn't be here. And then you realize, damn, it's not as hard as you think, you know, or as you perceived it to be. Just you got to learn the job.
I don't know who said it, but I know it's somebody big in history. But the more you know, the more you realize you don't
You
know.
don't exactly.
And so I think that's a part of the like you'll see some people that are like super, cocky and
Stay away. Stay away.
yeah, right. And when you really look at it, you're like, man, how is this guy like on that level of confidence when somebody else is like, light years ahead of them with knowledge or experience or whatever, and they're questioning themselves. And it's exactly that. It's once you open your mind to knowing how much knowledge and how much opportunity there is, you start to critique everything else. So, you might have a foundation set, but the more you understand and how to build that foundation, then you're breaking down that foundation to its roots and you're trying to see like, okay, how can I build this foundation even stronger type of deal, right? So you get higher, but then you start looking on the inside as well,
So,
like introspective.
It's kind of like, say somebody goes swimming in it, right, in a lake, right? If they don't know how deep it is, they think they went, 5 feet deep. It's like, bro, I'm that guy. I swam through the bottom of the lake. But somebody who actually knows that it's a 500-foot lake, right? And they're in their they're afraid of the other, I guess the darkness underneath the lake that they really don't know about. Whereas the moron who doesn't even realize that how deep the lake is, he's so confident, don't even worry about it, bring the kids in, Whereas somebody who actually has the knowledge of what they're getting into, they're like, no, let's you're a little bit more cautious, I guess.
That is, right? So like that's actually a great analogy, right? So you have the person who knows a great amount on oceans, right? And this person will probably go into Lake Michigan, we'll say, right? Because Lake Michigan is usually a pretty dangerous lake to swim in, actually. They'll go in with like a swimming vest on or whatever, and protective gear. And it's because they have the knowledge of what rip currents are, the waves, and the different seasons. Versus somebody, you're right, who's been swimming in a kiddie pool their whole life. It's like, I can swim on that. Like, there's nothing. It is a false confidence. It is. Yeah.
So I guess that's where imposter syndrome comes from, right? To your point, in terms of imposter syndrome, because once you know what you don't know or how much more you can know, you kind of feel like, man, I shouldn't be. Then you start actually interacting with people and realize everybody around me is a moron anyway.
I say I won't take it that route. I'd say the more you end up realizing that everybody else feels the same way.
Yeah.
Right. So it's like that imposter. So you end up realizing everybody's like people have. It's funny, and I think I know I've dealt with this a lot, but where I go in and I'm like, I don't know, but I see that the person that's talking to me is getting more confidence out of me than I have in myself, type of deal, right? And so that is when that's almost the antidote to imposter syndrome. It's just realizing like, hey, everybody's in the same boat.
See, confidence is such a tricky. It's something you can't teach, right? It's something you either have or you don't, and you kind of have to build that muscle on your own.
I like the way you put that. It's not something you can teach, but it's definitely something you can learn.
100%.
Yeah.
100%. And it's hard because you wish you could just grab somebody and shake them and say, just be a little more confident, man. Like you're capable of so much more. But it's something you just have to kind of go through the process of, honestly, putting yourself in uncomfortable positions, right? You put yourself in a position you're not used to.
And you're hitting on some deep stuff over there. So yeah, look, growth leads or uncomfort or discomfort leads to growth. Comfort leads to complacency.
Right.
And you could apply that to anything. You could apply that to career. You can apply that to physical body, mental, emotion, right? Like all of it. Like if you are in a position where you don't go to the gym and you're not working out a muscle, you're comfortable, you're chilling at home, but what's going to happen to you, right? Your body just naturally just shrinks, right? Like you're either going to gain weight and become fat, or you're losing the muscle mass that you have. Versus when you're in a gym, it's not a comfortable place to be in, right? Like physically lifting weights is not an easy thing to do. You're uncomfortable, but it is leading to growth. So I agree. It is. You have to be uncomfortable. If you want to be better at talking to people, get yourself in front of people.
So down back to pharmacy a little bit. How important is confidence towards your success in your career as a pharmacist?
I tie that back to the leadership piece of it, right? So depending on the setting you're in, you always have direct reports, people who report directly to you, or people that you have to lead. I think the hardest thing is to work in a setting where you're not confident in your leader. You lose that respect piece. You lose that executive presence you have. If you're not able to have that confidence, then why should your team listen to you?
100%.
You start to get challenged on things that you're correct on. So I think that's where I'll tie it back to. That leadership piece is the biggest one for me.
And I'd say don't try to be a leader. you just be a leader, right? A lot of times you see people who are trying to be the leader, and it just comes off so off-putting, and you end up being, you know what I mean?
I think that's where people end up being a boss more than a leader, right?
Right.
So it's just the demanding and not proving you're able to do it versus leading and showing the way of doing it. I think that's the difference in the two.
And I mean, I think what a leader is, right? First, you have to define what that is, right? Because we've seen some great leaders, they don't have the best confidence.
Right.
We have seen that, right? And what differentiates them is those people always take action. And that's how they get respect, right? They always take action. They're always there for their team. They always show up. They always support them in the right way. The confidence piece, I think it could be looked at. I mean, at least the way I look at it is, confidence, which to the boss, right, that can almost go into a sense of arrogance, where they seek their confidence level based off of other people's validations in a sense, or dominating the other people. And then the other side of it, which is self-assurance, like you are sure of yourself as a leader or as a person, that it doesn't matter what the noise is. Ultimately, if I go in and I establish myself as a leader and I'm sure of myself, even if I don't have that initial, respect or that initial buy-in from the team, if I just stay true to myself and I continue and I continue to get the team, ultimately they will buy in. Right. So it's that confidence piece could be like you can assert dominance versus you're sure of yourself and you'll eventually get people to kind of buy in.
Right.
So it's an interesting dynamic. But again, confidence going into leadership, like we've seen it both ways. There's there's all types of different leadership styles, right? There's the type of person that will, establish their dominance and they want to take control and they make the decisions. There's the type of person that more, connects to the people and allows them a pathway to speak their mind. And people love being heard, by the way, right? Like if you acknowledge people, that's the easiest way for you to gain respect. So that's another style, right? Another style is some people that are just very engaging, right? Like they just are so good at just talking to people and connecting with people and talking to stories and, hey, tell me about your kids and whatnot, right? So there's that engaging leader.
Right.
And then there's people that are just problem solvers. You bring them the problem, they'll find a way to solve it, right? So the leadership and the confidence piece, I guess the question becomes like, what's the definition of, like, what do you mean by confidence? What do you mean by leader, right? If you're looking at it as...
I think the reason confidence is so important in being a leader is to be a good leader, people have to trust you, right? So if I see that you're confident yourself, you're confident in what you're saying, you're confident in what you I guess in your method of leading, it leads me to trust you, right? Even now that I trust you, now you can be the leader that I probably need in terms of a leader who's right. Oh crap! Like you're just kind of hesitating. How do I trust you in what you're telling me to do? Right? As you're my leader, I'm following you, and all of a sudden you yourself are hesitating. Now I'm gonna hesitate. You know what I mean? So even if you're confidently leading me out of over a cliff, I'll probably follow you if you have confidence.
No, the way I look at confidence is just asserting your presence in a room, right? Like I guess you can call it like an executive presence, right? Like know who's walking in, right? Like when the boss walks in, everybody knows
alpha
who the
mentality.
boss. Exactly, right? Versus if you're just talking about confidence, there's somebody I know that a personality, like really really great person, right? Very calm. You would not think for one bit like man, is this person really really any good? But then once you actually start having a conversation with this person and you start to realize how confident they are in their ability, it's not their personality, right, that shows off confidence. But you're right. You gain trust. You end up trusting that person based off of the confidence they have themselves and the knowledge that they have.
Right.
So I guess I just define confidence as that executive presence type of deal versus like, hey, are you sure of yourself? I agree. Confidence in being sure with what you do, it doesn't matter what your style is. Right. So everybody could be a leader, right? You don't have to be a very specific type of leader.
Sal?
I agree. I'm going to go back to that same piece. Similar to what you said, it's that trust piece too. If you don't have that confidence, how are you the leader? Like if I have to feel like I have to take over who I directly report to, that's kind of weird, right? If I have to have more confidence than who my boss is, might as well be the leader in that case. So I tie it back to that trust and confidence piece.
I learned that the hard way in pharmacy where, again, because this is why I tied confidence so importantly to pharmacy is so as a pharmacist, your first experience, you're still learning, right? So I'm not confident in the system. I'm not confident in the job. I'm still learning it, right? So I'm kind of hesitant on acting like a leader to the techs who know more than me. You know what I mean? They actually know how to run and operate the pharmacy better than I do because I'm still in the training mode. And as I was up until I was confident in my job, that I was able to, it kind of felt like certain techs would take advantage of that, right? It's like they're pushing things that they should be doing on you when you have more important things to do, right? And that's when I learned. As soon as I got and I felt confident enough in what I'm doing, that's when I learned to delegate. That's when I learned to basically hold the pharmacy down. And I feel like that's what it comes down to. If you don't know the job, if you don't, whatever it is that you're leading in, if you don't know how to do it, it's really difficult for you to delegate to someone else when you clearly, like, you come in there as a boss. Well, why don't you do X, Y, Z? And they look at you like, well, because that's not the way to do it. Now you look like an idiot, right? You've lost their trust, you've lost their confidence, and you can't really be an effective leader.
So this goes back to that concept we talked about earlier about advocating for yourself, right? In what ways you could do that, right? So now you're almost talking about like the house, right? You're right. It's actually something that a lot of people struggle with because that's a version of leadership, right? That's you delegate to the team what everybody does. What has worked for me in the past is knowing that. Like, like going into a situation where you don't know everything. You know that the individual that's reporting to you knows more than you do. That's an opportunity for you to get that person's buy-in, for you to engage that person and to say, hey, I know you know this stuff. I'm going to have you leading this stuff. And that's actually a form of leadership, right? Leadership is not always leading from the front. It could be leading from the side or leading from behind.
You boosted their morale.
You boost their morale. You get their buy-in. And at the same time, you could learn it from them, right? Hey, teach me how to do this stuff. So leadership, again, it's not necessarily just from the front. It could be from the side or from behind. And in real leadership, I can't state this enough, you're not going to know everything. And people lose confidence when they don't have, when they don't know anything.
Right.
And when you have everybody coming to you looking for answers, you're setting yourself up for failure.
Right. That's not good.
You're setting yourself up for distrust, and you're setting yourself up to disappoint somebody. But if you're just honest from the front, hey, I don't know everything, and this is actually as pharmacists, right? A lot of times people don't feel confident in making a recommendation because, like, hey, we went to pharmacy school, we should have all this information. No, it's not what pharmacy school is. Like, we know how to find any answer, but we don't have all the answers.
I think it took me a second to learn that and to be okay with that in terms of when people come ask you for over-the-counter medications, right? It's like, okay, hold on, give me 1 second. And I had to play it off. And then I was like, you know what? No, let me, this is what I'm good at. This is, if anything that I learned in pharmacy school, regardless of what knowledge I forget, I know how to get it like that.
You know what my response to those recommendations always was, and it always worked? Man, that's a great question. Let me look into that. Right? And really, they trust your opinion after.
You look it up and say, this is X, Y, Z. This is what you need. This is what you do, right? And I think that's something that people don't really realize about pharmacy is, you said it best, is it's not about knowing everything. It's about knowing how to access everything. And I feel like those resources, right, how to find, and not just that, how to read through it and what it means, right? You've built the medical, I guess, vocabulary to be able to process that information and say, well, this means X, Y, Z.
And going back to that leadership piece too, right? If you start to recognize your people for having that type of knowledge, they start to appreciate working for you more. Now they actually see you as a leader. Nobody wants to work for that know-it-all, right?
Yeah, people want to be seen.
Yeah, so once you recognize them for it, they start to feel like they're seen, they're valued for their job. Now they enjoy working for you. Now it's not so hard to lead, right? You don't feel like you have to drop the hammer every time you want to prove, like, hey, I'm him. I'm the guy you're answering to. Right. So I feel like that recognition piece. So not knowing everything could, like he said, play into your hands.
Rather than being a negative, you turn into an opportunity.
Yeah, exactly right. There's an opportunity. There's the recognition piece that you said too, right? And usually what you'll find is even the people that like to filter information down and everything comes through them, they'll need to get this information from somebody, right? And they'll usually take the credit for it. Right, because they're not in a position where they're comfortable with saying, I don't know, let me get you the answer, right? So I agree with that. Like, you want to recognize, but it also gives you the opportunity to create new leaders, right? You're as strong as your weakest link, right? That's I think that's the saying, right? And so if you have a team or you have somebody on your team that's not as strong and you're not using that opportunity to kind of allow them to lead, they'll never work that muscle. They'll always be weak for you.
Right.
Versus allowing other people to take those opportunities, you actually become stronger as a team.
I'll tie that down to like the business world too, right? If I have to always be present in my business for my business to operate because I have to constantly lead, versus I coach the next guy to be able to lead, now I'm able to step out and start my next venture.
We talked about that last week.
Yeah, that's very important, especially in the food world, right? Because quality control is so important, right? And consistency and customer service, all of that plays a role, and that comes back to how good is your team, right? You got to assemble the right team. You got to train the team. You got to set procedures for them to follow. That way, when you're not there, you still have to have some form of presence. Just from my experience, right? It's really hard to find the right team, right? People who are motivated enough and people who understand the responsibility that they're given. And when you do, it's like, oh man, weight lifted off your shoulders, right? But it's difficult, but definitely, what is it? Tony Robbins or somebody said, he said, don't be a business operator, right? Be a business owner, meaning an operator is somebody who operates a business, whereas a business owner is somebody who can own multiple businesses. And that's to your point, but it's easier said than done.
For sure.
That's why there's that saying, do as I say, not as I do, right? A lot of these concepts that we just talked about are easy to say. These are concepts, right? But everybody struggles with them, even like the leaders. But, when you're talking about like the food business and, allowing a team to kind of grow or allowing them to take that next step, what you're talking about is, I think you had mentioned like, hey, it's tough to get a good team. I take that and I say you have to have the mindset of you can make anybody into a leader. And I think if you have that mindset, you'll be patient with that person because naturally people are good at different things. Right. Now, you might have somebody that might not be the best cook. They might not make the best smash burger out there, right? But that person might be the best customer service representative in your truck. And that does play an important role, right, in that role. Or you might have somebody who's just very tactical or very strategic and is able to get through a certain process very quickly. And that person is operating making you more efficient as a restaurant or as a food truck or as whatever. Right. So again, it's the ability of you have to define what the leadership is, what it is you're trying to extract out of this individual. And at the same time, you don't necessarily have to have somebody that's going to take over your position. But if you want to be able to walk away comfortably, you're going to have to let them stumble a little bit. And it's okay if they make a mistake. Give them grace. Teach them. Go back. Reteach and whatnot.
I think we've kind of touched on a few topics here, but definitely to be a pharmacist, you got to learn how to be a leader, right? And I think that's the first thing that was just kind of, because going through the pharmacy school, the program, everything's kind of lined up for you, right? And then you get out there and it's like, they're going to respect me, basically, if I earn the respect. And you can't really do your job right if you're not a proper leader, right? And I feel like we've touched on a few topics and, aside from leadership, aside from the trust aspect, from a business standpoint, right? From the food, perspective, it's kind of hard to teach a lot of these things, right? And again, experience is the best teacher, right? You got to go out there and it's hard for people to grasp certain concepts. I don't want to say they're not complicated concepts, right? They're really not. But it's like I remember younger and listening, right? And somebody says, "Well, you got to be more confident." I'm like, what the hell does that even mean, right? Because I haven't even had experiences of being in positions where I wasn't confident. And you learn from that, right? You get to a point, it's like, damn, I should have said, I should have did. And it's like, the more times those kind of situations happen, the next time you're presented with a similar situation, you're like, oh, this time I got it, I'm not going to waste this opportunity. And boom, right? Like that, you just use your experience to learn something. So a lot of these things that we're talking about are more things that you learn through experience than something that you can actually teach someone.
So here's my pushback to that, right? A lot of times we look at teaching as one way, but we don't look at it as it can go the other way. So I'll give you an example, right? If you're trying to teach somebody how to do something, when's the last time you stopped and you asked a question to assess where their knowledge is or if they know why you want to teach them that thing.
It did what we did. It was definitely a great conversation. Appreciate you guys being on. And the take-home message for today is: don't go to pharmacy school. No,
No.
definitely not.
definitely. You
No,
don't-
no, it's not.